Welcome to Startup Health Now, the weekly web show that celebrates the healthcare transformers and change makers reimagining healthcare. My name's Unity Stoakes, and super excited today because we're at Health Datapalooza with Bryan Sivak, the former CTO of HHS, and we're going to have a great conversation about what it's like to be an entrepreneur in government and a lot of the exciting things that are going to be coming in the future. So stick around, it's going to be a great show. Thanks.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
So welcome, Bryan. How are you?
I'm great. Thanks for having me.
Thanks for being here, and it's wonderful to be here at Health Datapalooza. I know you've been so involved and instrumental at what's going on here. For those that might not know, what is Health Datapalooza?
It's a good question. I think Health Datapalooza can be a lot of things to a lot of different people, but at the end of the day, to me, it's really a gathering of a community of people that are fundamentally interested in and sort of deep believers in this idea of health data being a key catalyst, if not the key catalyst, to transforming the healthcare ecosystem in this country. And to me, it's just really fascinating to see so many people from all different walks of life and demographics. And
it's really turned into a movement.
It really has, yeah. I mean, it started with 45 people in a room at the Institute of Medicine about 5 or 6 years ago.
Yeah.
And now we're up to a couple thousand every year that come to DC for a few days to listen to all kinds of people talk about health data and do interesting things. So I think it's fantastic.
That's wonderful. So, just to kick things off, what is it like to be CTO at HHS, or what does that role entail?
It's a lot of fun. It's challenging at certain points. It's exhilarating at others. You get to learn a ton about how government works, how it doesn't work in some cases, ways that it can be made better. You meet a lot of really great people. That's one thing I think that a lot of people don't quite realize about government is that there are some of the best people I've ever worked with in my life work in government, and I've worked with them now across 3 different government jobs on the city, state, and now federal level.
And you really started as an entrepreneur, correct?
Yeah. I started a software company in 1997 in San Francisco, enterprise software.
So what's it like then? Because most people think of government as the opposite of entrepreneurial, but it seems like you talked about some of those people. A lot of the people we've come across are entrepreneurs that have come in to government, at least on the healthcare side. People, I think of Todd Park as an example. Mm-hmm. What's it been like for you being an entrepreneur and trying to work within government the last couple of years?
I think a lot of people don't realize just how possible everything actually is in government. The problem is that I think too often people get hung up in trying to ask permission for things or trying to, navigate through red tape when in fact they really should just go and do stuff. That was sort of my MO actually during all of my government years, is just to kind of focus on a goal, make sure that goal is one that obviously advances the interests of the administration that you're working for, but also that hopefully has some positive outcomes both systemically and in a specific area, and then just go for it, rapidly.
Almost more like a lean startup.
That's a great way to think about it. So we espouse a lot of lean startup concepts: rapid experimentation and iteration, MVP, low-res prototyping, all kinds of stuff like that. And not just for technology, but for all kinds of things. With the idea being that if you can spend a short amount of time validating whether or not your idea is a good one or whether it's going to work, you can actually get better results when you start to scale and really start to get into the meat of what the hierarchy is and bureaucracy is either trying to do or trying to prevent you from doing, right? And so that data is incredibly powerful.
So when this concept of data, and we're here at Datapalooza comes up a lot, and actually I think last year in the private sector, 25% of the funding for digital health and healthcare was going into big data and analytics.
Mm-hmm.
What does that mean? What does data mean in the context of health and of wellness? What's possible when we start to take this concept of data and do something with it?
So the way that I've actually been thinking about it kind of recently, this is maybe the first time I've actually said this like in a recorded fashion. So it's still a bit of a nascent thought, but the way that I've been thinking about this recently is that there are, to me, sort of four major types of data in this universe. You've got statistical data, which you can think of as data sets that are created by census-type agencies or organizations going out and interviewing people or doing surveys or collecting lots of different data points about people and then somehow charting that to show changes and trends over time. A second type of data might be something like administrative data. So claims data, for example, would be a good example of administrative data. A third would be clinical data, all the stuff that gets recorded when you're at the point of care or elsewhere these days. And fourth would be, I think, a relatively nascent category of data, which is personally generated data. And these
is that all this exhaust coming from wearables?
Sensors and all that kind of stuff, yeah.
Okay.
And so I think each one of those different data types bears thinking about differently because there are different challenges and different potential use cases, both individually and when they're combined. So one really good example of a combination of these, something the CDC is actually just starting to look at, which is for decades, the CDC has been running these nationwide surveys of people, both in person and over the phone, to get various sort of pieces of information about trends in the demographics of our society over time, and the health of our society over time. They're actually starting to think about ways now that they can enhance that data collection by leveraging data that comes from wearable devices.
Wow.
It's obviously
so layering it together?
Yeah. So it's obviously a pretty tricky subject, but if you can figure out how to weave that data in, you might actually get a much deeper and more interesting picture of the American public. Right?
It's so interesting because I know one of the buzzwords that comes up, or one of the big challenges, is this concept of interoperability and connecting data or syncing it up. And I know there's been a lot of complexity around that, but I wonder if there doesn't become a leapfrog moment almost where new systems with all these different wearables and new platforms, say the Apple Watch and others, just automatically start working the same way and linking up. Is that possible?
So it's possible, and I think the way that happens is less through sort of government regulation and mandate of the interoperability of the existing ecosystem and infrastructure, and it more happens when the universe changes and people start to get compensated and paid in different ways. So a great example of this to me is what's happening in the state of Maryland right now. Most people don't know about this, but about a year and a half ago, the state of Maryland negotiated a waiver with CMS that has essentially resulted in every hospital in the state of Maryland being essentially fully capitated. They're all on global budgets. So, simplistically, it's more complicated than this, but simplistically, Johns Hopkins has $1.2 billion to spend this fiscal year. And if they spend more, they lose, and if they spend less, they win. And what's happening as a result, and this is also still very nascent, but what's happening as a result is the State Health Information Exchange, CRISP, is all of a sudden incredibly important.
Right.
And they're going to CRISP to actually get the data that they need to get to operate their system in the right way so that they actually remain profitable while still delivering quality care.
Wow.
And it's fascinating.
So now that the incentives are changing, they're looking at data in a whole new way.
Totally different way. And it becomes that much more important. And so I actually believe that if you change the incentives, everything else will change along with it. And
that makes a lot of sense.
And this interoperability thing that we've been trying to figure out forever will kind of go away.
So what does this all mean for the entrepreneurs out there, the innovators that might be either thinking of new ideas and just getting started, or those that are already well on their way? What advice would you share with them on well, just what advice would you be sharing with them?
Well, I think there are general categories of advice. One is sort of the generic advice to startups that I always find myself giving to people, which is you have to focus, right? I think back to when we were doing our startup, and actually ever since then in everything I've done since, especially at the beginning stages of something, there's so much possibility and so much potential in so many different avenues that the natural tendency, I think, is to sort of try a bunch of stuff and see what works. But I think what happens is that as you start focusing on as you spread your focus to too many different things at once, you lose focus on the things that you need to have focus on in order to actually knock it out of the park. And so I generally, one of the pieces of advice I find myself giving most often to startups in particular is to pick something and really just nail it, right? And once you've nailed that one thing, then it's time to kind of look at what other opportunities and options are out there and kind of explore those things. So that's like the generic advice that I would give.
Focus.
Yes, without a doubt. But focus in the right way. Rapid, iterative experimentation. But listen to what the data is telling you. If you're experimenting and the experiments aren't working, change your focus. Right.
Right.
Maybe the health specific stuff that I would think a lot about are really thinking about who you're designing for and what market you're designing for. So we're in I think a very interesting transitional period, or maybe in the very beginning of an interesting transitional period here in the U.S. The majority of healthcare in this country is still based on fee-for-service medicine. The entirety of the infrastructure is based on fee-for-service medicine. But there's this change that's looming, right? Maryland is just sort of the pointy tip of the spear when it comes to this change, where we're shifting theoretically from this, transactional type of arrangement that we have to one that's much more sort of holistic and value-based. Right. And there's nothing really out there today that truly supports a value-based healthcare universe.
So does that mean too many companies are focusing on building for an old construct?
Well, that's one way to think about it. At the same time, it might be too early to think about building for the new construct, which is why I say we're in this really interesting transitional period. So if you're a startup and you're thinking about the future of healthcare and you believe that it's going to go in this value-based way, you'll be tempted to start to build things for that universe. You might be a little too early.
And then right? You need the business to support yourself to get there.
Or you need the capital to tide yourself over while the rest of the universe is catching up. Or you need to have a very clever product that will work in both universes, right? So I think there's a lot of things to think about.
Do you think there's new models emerging as well?
Yeah.
Meaning, I don't know, I think of health consumerism as an example.
Well, if you think about the value-based model, right? So I think a lot of people tend to think about it from the provider side or from the payer side. These are the people that are actually paying for this stuff. Right. But I think if you're really considering a true value-based model of healthcare, it has to have the individual at the center, because it's all about the individual, right? And so I think that, we're still, like I said, in the very beginning phases of all of this. And so we have some models that we've been testing, ACOs and shared savings programs and bundled payments and patient-centered medical homes. And, we tried the HMO thing a while back. And there's just a lot of different mechanisms that you can imagine all of this working in. But I think that there are still plenty of iterations yet to come that we don't know about and we haven't really thought about, we haven't experimented with. But I think the thing that's very clear is that we can't keep doing things the way that we are. Somebody said to me the other day, I think I've read this too somewhere, and I think it's a really interesting way of looking at it, is that if we keep on our current trajectory of spending when it comes to healthcare in this country, the United States is going to be basically an insurance company with an army, right?
Right.
And it's true.
So so you mentioned focus, you mentioned really understand who you're building for or designing for, I guess understanding not just your customer, but your user, which is often different.
That's right.
In healthcare.
And the beneficiary, right?
And the beneficiary, exactly. So what else, maybe on a very practical level, let's bring it down to maybe, say, startups working with government.
Mm-hmm.
One, is that a good idea? Do you think they should start there? Should they start maybe just in the real world, so to speak? I know the government's is the biggest customer of healthcare. So what would your advice be to startups in that regard?
A lot of it depends on the product, but it's really, really hard for a startup to effectively interact with the government. The problem is that the mechanisms that exist and the culture that exists to procure products and services from the startup community, or from, actually I should just say the community, requires a lot of bureaucratic red tape that startups will not have the capacity for the most part to deal with. And I think that the amount of time and effort and resources that would be spent dealing with the government in that perspective would make it incredibly challenging to have an effective business.
It takes it away from that focus.
That's right.
Yeah.
Unless your thing is all about government,
right.
I would tend to be incredibly opportunistic about that and set the bar for opportunistic engagement very high, because it's so distracting and it takes so much time. But having said that, there are some decent examples of startups that have engaged successfully with government. So I don't want to say don't do it, but just think about it very, very carefully.
And the government, one of the things that we've noticed, and in fact, we launched Startup Health at the Health Datapalooza 4 years ago.
Right.
It's been a great catalyst, I think, to, as you mentioned, bring community together, inspire new talent, inspire capital to come in. Now that you're, I guess now that you're no longer in the current CTO role, if you could wave a magic wand, knowing everything that you know about working both within government the last many years, but also being an entrepreneur for so many years and building great businesses, what would you do to really solve some of these big challenges we've been talking about?
So the first thing is I would stop thinking about the big challenges. If you look at the theory, like some of the theories about change that have been published in academic literature, one of the things that really stands out is that it's very rare, and maybe it never happens, that you solve a big problem by going after the big problem. But what works is when you break up that big problem into lots of tiny little individually bite-sized problems that you can actually look at and understand potentially how you as an individual or you as a small organization can work on solving that thing. And then by solving that thing, it sort of builds this foundation that allows you to then work your way up towards that big problem. And I think that's one of the things that we've really been thinking about in the wrong way across the board, is that, we take interoperability. We look at it as this massive systemic thing that needs to be fixed. And sure, it absolutely does, right? We need to have systems that talk to each other and data that flows. But if we try to conceive of this solution in that big systemic way, I don't think we're going to be successful, because it's impossible to solve the big problem.
It gets back to that lean methodology again, where incremental fixes every day.
Right. Solve something little that's a critical component of that to work, and eventually you'll build your way up to solving the bigger problem.
That's wonderful.
So that's kind of one of the things I've been thinking a little bit about lately.
So what are you most excited about today? Either generally, or it could be specific technologies or specific solutions. Just what gets you really juices flowing?
So, it's interesting because my background has been healthcare for the last few years, but before that was not. And so I have a bunch of different sets of experiences that now that I am a free agent, I guess, for lack of a better term, I've been kind of exploring different possibilities. And I keep getting drawn back to healthcare because it's so interesting on one hand. On another hand...
This is good, because we need to keep all the great talent in healthcare.
Well, it's amazing, right? Because first of all, there's a ton of opportunity. I mean, especially if you're thinking about technology and the space, we're decades behind where we should be in a lot of different places. And so there's a huge amount of opportunity and a huge amount of things to think about. And maybe most importantly, it's meaningful. Like it truly matters, right? If you can solve some problems in healthcare, you're affecting people's lives in a way that you couldn't in other industries and other fields. It's fine to build the Uber for whatever, or to build Uber, right? Mm-hmm. But it's a much different thing to actually build something that enables people to live a better life, right, from a physical perspective. And so that in general is what gets me amped up. In terms of specific technologies and things, there's all kinds of stuff, right? 3D printing, I think, is incredibly nascent in healthcare and totally fascinating. Everything from... I
just met a company that was making casts.
Yeah, so...
3D printing casts.
Well, actually, so I gave this talk a couple of years ago where it was actually kind of a funny talk because I sort of imagined relatively near-term future of healthcare, and I used myself as like sort of the main character in the story, and I took a picture of myself like in a mirror, sort of like shirtless, in the morning, just imagining I'd woken up and had the mirror kind of be this array of sensors that was telling me all these things about, what I did wrong last night, shouldn't have had all those beers, shouldn't eat that slice of pizza, all this stuff. And it ended with me biking to work and then getting in an accident, breaking my arm, walking to the Walgreens, and having a cast 3D printed for me right there, right? So this stuff is happening. It's like part of it. And those are actually the easy and really like, immediately understandable applications of the technology. But think about what can happen. Let's just say in the next 20 years, we figure out how to 3D print a working kidney, right? So we spend...
There's a company in Brooklyn, Modern Meadow, that's working in some of these things.
So think about this. We spend about $30 billion a year on end-stage renal disease, okay? Just as a point of reference, the entire National Institutes of Health, their budget is about $32 billion a year. Wow. Okay? So on one disease state, it's obviously the end state of a lot of different conditions, but like on one thing, we spend what we spend on all of the medical research and health research and all the administrative functions of the National Institutes of Health every year.
Extraordinary.
Right? So if we just like fix a little part of that, all of a sudden we have that much more money to dedicate to something else.
So just to wrap up here, predictions for the future then, you're optimistic?
Oh yeah. I'm optimistic because, we can't help but to be optimistic. If we keep going on the trajectory we're going, we're done, right? And if there's one thing that America's really good at, it's like getting to the brink of something and then figuring out a way out of it. And so I totally believe that we will figure out a way out of it. What that way is, I don't know. I have this idea that the future of healthcare in this country looks a lot like a bunch of regional Kaiser-type entities that are sort of vertically integrated systems that have incentives aligned between the paying side and the providing side and the patient side. And it's almost like a network of single payers, right? Where in these regions, people are, these organizations are pretty strong, but they, sort of bleed people around the edges depending on where they live. I just have this idea that it could work out that way. But
so our belief is it's going to be the entrepreneurs, it's going to be the innovators, the healthcare transformers like you that as a community, as an ecosystem, collaborating with government, collaborating with industry that are really going to fix this problem over the next decade or two. So couldn't be more excited. And I just want to thank you. We at Startup Health want to thank you for your service and everything you've done to be a catalyst and inspiration for the ecosystem. It's been very meaningful. So thank you.
Oh, my pleasure. It's been honestly an amazing experience that I wouldn't trade for a second. And so I actually strongly encourage everybody to give it a shot. I don't think you could know. It's hard to comment on how government works without actually being in it, so it's worth a try.
So everyone go do your service in your community or for the government in some way. Thank you all for being here. You can get these episodes and more at startuphealth.com/now. Thank you.